I told her that we are starting, and I haven't heard back. So, um, whatever you want to do with that.
Okay. Well, no worries. Hmm? Laundry. Elena is here. Laund. Yeah, no worries. No worries. But meanwhile, if you want me, I can repeat myself. If you want me to go over some stuff, I can go ahead and get started.
Sure, I'd love that.
Um, you want to do where we're starting from week 3 and or go all the way to week 1? Either way is fine.
Um, Whatever everybody else wants to do. I had like a couple specific questions for week 3. Um,
Okay.
some of the like just figuring out how like the sternothyroid is oriented with the other muscles around, and then um, the great auricular nerve and the lesser occipital, I think. Yeah,
Okay. Okay.
lesser occipital and great auricular nerve. I'm having trouble separating the two.
Okay. Okay. That is so the nerve, lesser occipital, greater auricular. We're gonna go over all the nerves. Okay. What else is it with the muscles? The
Like the sternothyroid, those kind of muscles in the front.
the strap muscle. The strap muscles. Okay. 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 I got you. Okay. Let's do that first. Okay. So basically, Elena, let's see, and we can do this again when everybody is here. So the muscle that dangling down from the on the cervical region, basically, and all these muscles, I'm going to remove the platysma. That's the platysma right there. I'm going to remove it. Platysma is easy. Now this is also the platysma. I'm going to remove it. These are called the strap muscles. Actually, I don't know if you studied this. The proper way to study this is what we call it, like cervical triangles. This is actually one of the triangles on the neck. Okay, one of the cervical triangle in the neck. This triangle here is known as the muscular triangle. Muscular triangle by classification. Uh, this is the sternocleidomastoid. I'm going to remove it from one side, from the left side, but I will leave it on this side. Okay, so this is the sternocleidomastoid. Now, very characteristic for the sternocleidomastoid is just when you highlight it, even in the anatomage table, if you just hit it, it will show you that it's coming from the sternum and the clavicle right there, and it goes all the way to the mastoid, and it's a massive muscle. You won't miss it. It's a massive muscle in the neck. It's a major muscle. So I'm going to remove it from this side because I want to show you the triangle that we're talking about. So basically, this is called the muscular triangle. And these muscular triangle is part of what we call them, because they are like straps, like strap muscles. Okay, so one of the confusion that's always happening is the names, the way they are named, because they are very similar in the names. Okay, and that's what, depending on if it is going to the hyoid bone or is going to the thyroid, but they are all have like similar um, prefixes and suffixes and so on. So, for example, like this one is coming from the sternum, like the part that says sterno is referring to the sternum because coming from the sternum and goes all the way to the hyoid bone. So, and as such, is going to be called sternohyoid, sternohyoid, sternum to the hyoid, the sternohyoid. Sternohyoid. That's one muscle. So I'm going to remove it from here. Sternohyoid. Now, the way in the anatomage table you identify it, when you click on it, if it is highlighted, you're going to notice that is actually coming from the sternum, partially small amount between this area, the joint in the sternoclavicular joint, but mostly from the sternum. But it's always going to hit the clavicle, the hyoid bone. When you hide it, if you think this is not the muscle, so what you want to do, if it is not connecting to the hyoid and the sternum, then it must be the one underneath. And underneath, there is two of them. One goes again from the sternum, but it stops short. It stops at the thyroid cartilage. Makes sense? And that's what's called sternothyroid. See, the one that we just removed is the sternohyoid. I left it on this side, sternohyoid, sternum to the hyoid bone. But the shorter one is going to stop at the thyroid cartilage, and as such is going to become sternohyoid. But there is another smaller muscle. This is omohyoid. I'm going to remove it from here. So another one that basically, uh, when you think about it, the sternohyoid, it does the movement all at once. It goes from the sternum to the hyoid bone. However, these two here, what they do, one gets it all the way to the thyroid cartilage, stop there. Another one picks up from there and continue the move all the way to the hyoid bone. So on this one, the first one here is going to be sternohyoid. The second one is going to be a sternothyroid. Sorry, see, I have missed it. Sternothyroid, and the second one is going to be thyrohyoid. Thyrohyoid. So basically, in other words, this one, this muscle, which is the sternohyoid, makes it in one shot from the sternum to the hyoid bone. But these two, what they do, one stops at the thyroid, and then the other one picks up from the thyroid to the hyoid. So let's look at the names again. If I'm going from the sternum all the way to the hyoid bone, I'm going to be called sternohyoid. Sternohyoid. From the sternum all the way. By necessity, you should see it attached to the hyoid bone. Okay. So basically, look at the attachment. One of them from the sternum all the way to the hyoid bone. Now, the two shorter one, they do it in two movement. One goes from the sternum to the thyroid cartilage, and we're gonna call it sternothyroid. And the other one picks up from the thyroid cartilage to the hyoid bone. We call it thyrohyoid. Thyrohyoid. Okay. So these are all strap muscles, and all of them, basically there are only three of them. Um, they are all infrahyoid. So by classification, they are below the hyoid bone, and that's why we call them infrahyoid. Infrahyoid. The one that I removed from the other side, another infrahyoid, which is the fourth one, is going to be your omohyoid. But remember this though, for the omohyoid, it has to go lateral all the way to the scapula, right? That's what omohyoid is. So omohyoid to the scapula, and the one that go to the sternum are going to be called as such. So sternohyoid, from the sternum to the hyoid, and then underneath it, right below it, if you remove it, you're going to see these two. One goes from the sternum to the thyroid cartilage, and we're going to call it sternothyroid. The second one picks up from the thyroid cartilage to the hyoid bone, and we're going to call it thyrohyoid. Does that make sense?
Yes, thank you so much.
Oh, yeah, of course, of course. Always look at the names. So the name tells you everything. But of course,
Yeah.
in the exam, you don't have the names, but you have the structure. So basically, your orientation in the anatomage table is going to be highlighted. So if the muscle highlighted like this, or pinned, has a pin on it, um, you're gonna, the first thing you want to notice what it's coming from. If it's coming from the sternum all the way to the hyoid, so you're just gonna call it sternohyoid. If it stops short, basically it goes halfway, not halfway, like one, two-thirds of the way to the thyroid cartilage. I'm going to call it sternothyroid. If it picks up from the thyroid cartilage and it goes to the hyoid bone, I'm going to call it thyrohyoid. Thyrohyoid. Okay. And then the last one is going to be uh, the one that under the hyoid bone. If it is going lateral like this, you see, you're going to notice it's going all the way lateral, going all the way like that. It has two bellies actually, but visible body gives you only one selection. That's omohyoid, omohyoid. All right. Now to the nerves. All right. So now the nerves that they have them here. Um, so basically, get oriented first of all. Are you in the occiput? If you are in the occiput, I have a female here, as you can see, with her um, ponytail or whatever that is. So if you go all the way to the occiput, okay? If you are in the occipital region, you have three nerves to worry about. Three nerves, and you see them like highlighted here. Actually, more than three. But if you are going towards from the midline all the way out, these are the three that you're going to see. Now, if you want to go in order, either from medial to lateral or from lateral to medial, it's the same thing. The easy way is to go from lateral to medial. From lateral to medial, you have a nerve that doesn't go all the way deep in the skull. See this one? See the two nerves? This is one I'm pointing at. This is another one right there. One of them goes way further down. Basically, it reaches all the way to the vertex right there, all the way up. So that's going to be the great. This one here is going to be the lesser, the lesser. So it's going to be your lesser, which is like, remember it two ways. One characteristic for it, it is, it stays short. Basically, doesn't go like all the way to the midline of the skull. And the other characteristic of it is the most lateral one of the three. So it's going to be your lesser occipital. That's a lesser occipital, lesser occipital. Okay. So if it is pinned, just notice it is not going deep in there. Basically, it covers most of the fleshy part of the muscle. This is occipitofrontalis. Okay. It covers the fleshy part, but it doesn't go deep in the aponeurosis of the muscle. The second one, which is like in the middle, closer to the midline, but it goes further away, all the way up there. That is the greater occipital nerve. Greater occipital nerve. They're both part of the cervical. This is a C2. Yeah. So, and it goes way deep in there. This one here is going to be the one that's coming from a C2, right? So, but they're both coming from C2. Now, the last one, which is the one that I called it unfortunate one, which is going to be coming from a C3, this one right there. So this is the third. What? It's not open. Yeah. The third occipital nerve, also known as the least occipital nerve, branches of the third cervical nerve. So it runs through, it barely shows. And I don't know if you have it in the list. I don't think you have it in the list actually. You have the lesser and and the greater, but you don't have the least. Oh yeah, okay then. Yeah, okay then. Yeah, if it is there, then yeah. So these are the three. So one lateral one. This is going to orient it. Lateral and shorter is going to be the lesser occipital. Okay, lateral and shorter. Now in the middle and longer, it goes way into the aponeurosis. That's going to be your greater occipital. And then the one that's barely showing out, this is going to be, oops, right there. That's going to be your third. Third, you can say either third or least occipital nerve. Okay. All right. So these are these ones. Now I want to put the muscle back. What just happened? One second. Somebody. Shanigua. Yep. All right. Hello, Shanigua. So I want to put the
Hi.
yeah, yeah. We just started, so uh, feel free to ask any questions if you want to. So I want
Oh, okay, so I haven't missed anything?
no, no, no. We'll go over the stuff. We just went over the nerves. We did the muscles, the strap muscles here, but I'll be
Yeah.
happy to go over the strap muscles again. But right now we're talking about the nerves. But I will
Okay.
repeat. I will repeat myself. No worries.
Okay, thank you.
So get oriented with the sternocleidomastoid because I don't know. The only problem is if he's going to remove the sternocleidomastoid. But anyways, but if you have the sternocleidomastoid intact, so because it's gonna give you like a way of looking at these nerves. Okay, so these are the one that comes on the occiput right there. So one more time. So the lateral one, the most lateral one, and it's shorter. It doesn't go like deep into the aponeurosis. It's a lesser occipital nerve. This one, what I'm showing right there, lesser occipital nerve. Go towards the middle. In the middle, a longer nerve goes all the way deep to the vortex almost. That's going to be your great, that's why it's called greater occipital nerve. Always think about the names. Sometimes the names don't make any sense, but in most cases, they have something to do with the structure. And this one, because it's tiny, it's least, two things. It's least because it's shorter, and then third because it comes from the third. So it's part of it's a third occipital nerve. So it's coming from the branches of the third cervical nerve, and that's why it's called.
Dr.
Now when
Hunt,
you uh-huh.
where would the great auricular be?
Yeah, yeah, we're gonna do those, the great auricular.
Oh,
So basically when you come to this side, so so you have several nerves here. So behind behind the auricle, behind the auricle, because I wanted to get oriented because if you see it like this, it will be easy. Yeah, it will be easy to remember them. So you have one behind the auricle. See now the one behind the auricle. This is part of actually cranial nerve number 7. It's called posterior auricular. So that's going to be your posterior auricular. Then you come to the front. See to the front. This is the different nerve. This is part of C5. This is auriculotemporal, auriculotemporal, auriculotemporal. Then now when you come to this one, see in front of the ear, that's auriculotemporal. Behind the ear, because you're gonna see those, uh, and it's confusing because it has something to do with the auricle. So this one here is going to in front of the auricle is going to the temporal region. Behind the auricle is going to be posterior auricular. Barely trying to reach the auricle, this one right there, barely trying to reach. See, this is the auricle. And this is the relationship that you have to remember. One front of the auricle, one behind the auricle, and one trying to hug the auricle from the bottom. That is your great auricular. One more time. So when it comes to the auricle, relationship wise, okay? So one behind the auricle, one in front of the auricle, and one trying to reach the auricle from the bottom. So the way you want to remember it, the one behind the auricle is easy. It's the same relationship, posterior auricular, but it's part of C7. That's part of C7. The one that in front of the auricle is not in the list, but I'm just giving it to you because at some point you're going to cover it anyway. So the one in front of the auricle. Sorry, I dropped something. The one that in front of the auricle is the auricotemporal, basically auricle and temporal region. The one that these are two cranial nerves. This is 5 and this is 7. This is a cervical nerve. Makes sense? This is if you read about it, this is from the cervical plexus. This is C2, C3. So this is the greater or great auricular nerve. Okay, got it? So these are the three nerves. Easy to remember them in relationship to the auricle. One in front is a C5. That's auriculotemporal, auricle and temporal region. One behind the auricle is a C7. That's going to be your posterior auricular nerve. One trying to reach to the auricle from the bottom is a cervical nerve. It's basically, it bifurcate like this, make this forking below the auricle though, right below. And that's going to be great auricular nerve. You got it?
Got it.
Got it.
Got it.
Because the thing is, the visual component when it comes to the anatomy is important because you just want to remember where it is. Okay, you have the idea. It's something to do with the auricle, but is it in front of it? Is it behind it? Or it's reaching from the bottom? So this is the easy way to remember them. One more time. One in front, one in the back, and one trying to basically hug it from the bottom like this. Those are three. And the three has something to do with auricle, the word auricle. One in front is a C5, it's a branch of a C5, is going to be auriculotemporal, okay, because it has something to do with the auricle and temporal region. One behind the auricle, right behind the auricle, is going to be posterior auricular, 5-7, okay? Now, one trying to reach to the auricle from the bottom and forking like that, that's going to be your great auricular nerve, okay? And if you want to make it even more complicated, between the auricle and this nerve and this greater auricular nerve, guess what? It's an actual C7, which is this guy right there. It's a C7. But we'll talk about that at another point. But again, so behind is a branch from C7, which is the posterior auricular. In front of the auricle is the auriculotemporal, auricle and temporal region, the one that are trying to reach, barely trying to reach to the auricle from the bottom, is a great auricular nerve. Yep. Now you come to this one. If you come to this guy, if you see a nerve, this is the um, sternocleidomastoid, right? Now the nerve that crosses over the sternocleidomastoid from back to the front, going to the platysma right there. This is the transverse. This one right there. It's called transverse cervical. Yeah, transverse cervical, transverse cervical, transverse cervical. Now the last one in this cervical ones is going to be this one. See, it has several branches. See this one right there, 1, 2, 3 branches. This is going to be your supraclavicular. It usually has 1, 2, 3 branches. If you remove platysma, then you will be able to see it right there. See, it has usually 3 branches. Okay, and this is the one that you already know. It pierces through sternocleidomastoid and goes towards the platysma. This will be the accessory right there.
Spinal accessory.
Yeah, accessory. Yeah, spinal accessory nerve. Cranial number 11. Okay. So any questions on the nerves?
Oh,
No.
good.
Okay. Yeah. Yeah. So basically what you want to do, I think these are the ones that are confusing mostly because they all auricular, but which one is which? If you get oriented, particularly if they gave you the auricle, or if I remove the auricle and then basically you will get oriented by the mastoid process, they remove, if there is no auricle, get oriented by the mastoid process right there, external acoustic, yeah, meatus, yeah. So in front of it is going to be auriculotemporal. Okay, and another characteristic for it is going towards the temple, basically temporal region. Behind is going to be posterior auricular, right? And the one that are trying to reach from the bottom is the greater auricular. The one that crosses sternocleidomastoid transverse is the transverse. The one that hanging over the clavicle is right there, hanging right over the clavicle, is supraclavicular. The one that crosses over from the sternocleidomastoid to trapezius is the accessory. Okay? So let's do the let's review the muscles again. How about that platysma and all those? No.
Yeah, that sounds great.
Okay.
Okay. Yeah, I removed the platysma here, but let me bring it again. So I'm going just by the list for week 3. So the platysma is this one. Usually uh, has this shape. If it is removed, then you will be able to see only sternocleidomastoid. But if it's intact, then it will be there. That's a platysma from right and left side. That's a platysma right there. Platysma. Now, trapezius, of course, you won't miss it. It's the one that in the back. If they have it highlighted, so looks like a right. Two of them selected like a trapezoid, but one of them just half like this. That's the trapezius. And then, of course, the sternocleidomastoid right there. You won't miss it, sternocleidomastoid. Is he going to ask like origin insertion or uh, naming? Do you know?
Just structures, I think.
Or just the structure? Okay, okay. So that's the sternocleidomastoid. So in order for us to go over more of the muscles, let me remove more of the muscles of the triangle. I'm gonna hide this, and I'm gonna hide sternocleidomastoid. Then these muscles here for the triangles, they are easy to remember if you look at where they're coming from and heading towards. Okay, okay, let's go over them. So now, the first one after sternocleidomastoid in the list is the anterior belly of digastric. So digastric is the muscle that has two bellies, which is this one here. Now, invisible body, it won't let you select. I don't know in the anatomage if it will let you select one or the other, but it has two bellies. So this where I'm pointing here, this is the anterior belly. This is the posterior belly. Very characteristic for digastric. Remember, it's coming from the mastoid, like right there. That's a mastoid process. Like underneath the mastoid process. That's what it inserts. And goes all the way to the anterior aspect of the mandible right there. That's a digastric. That's a digastric. Okay. Now, aside from the digastric, the one that you definitely don't want to confuse with the digastric, because only the digastric gives you this characteristic. It goes from the mastoid process all the way right there. The origin is not the mastoid process, the lower border of the insertion. It has two insertion. That's the thing about this, the posterior belly. So the inner side of the mastoid process. That's the posterior part. See, it's the mastoid process, but not because the sternocleidomastoid come from the upper aspect of the mastoid process, but this one comes from down, from the inner. But nonetheless, your orientation is the mastoid process. From the mastoid process all the way to the mandible. That's going to be your digastric. Digastric. I don't want you to confuse it with this one, which is stylohyoid. See, if I bring it closer, see, this is what I'm pointing. That's a styloid process. It won't let me select it. It will select the entire bone. But that area sticking out, that's the styloid process. So from the styloid process to the hyoid, that's going to be your stylohyoid. Stylohyoid. So not to confuse it with this, remember mastoid is going to be digastric. From the styloid to the hyoid bone, that's going to be your stylohyoid. Now, for whatever reason, they have the next one is splenius. But let's finish this and then I'll go to the splenius. This one here, I already talked about this earlier, but one more time. This is coming from the hyoid bone all the way to the scapula. If I remove trapezius, you'll see it. You see it goes all the way. See right there? Right there at the border of the scapula. This is omohyoid. This is omohyoid, okay? Omohyoid. So one more time. So from the mastoid process all the way to the mandible, that's going to be my digastric. From the styloid process to the hyoid bone, that's going to be my stylohyoid. From the hyoid bone to the scapula, that's going to be your omohyoid. Okay. Now, for whatever reason in the list, they have the levator scapula right there, which we already talked about it, but it's good to review anyway. So the levator scapulae is going to be very characteristic of it. Look at this, like the triangle of the scapula right there. This is the supraspinatus right there. So this is the spine. It won't be necessarily the spine, but this is the spine of the scapula, supraspinatus. Now, right at this age, which is like the angle of the scapula, going all the way, it goes to C1, C2, C3, C4, right there. So from all the way up, but if they're not asking you, that's fine. So C1 through C4, and it's the superior part of the medial spinal border of the scapula. That's where it goes. Okay, so that's this guy. Now the splenius is going to be this one. Splenius looks like a bandage. The word splenius in Latin means bandage. So it looks like a bandage. That's the splenius. They have the splenius in the list. Splenius cavitis. Splenius cavitis. There is another splenius, which is this one. It's underneath. It goes to the cervical region, and that's the splenius cervicis. But we had it in week 1, but they don't have it in week 3, at least. But this is the splenius cavitis. Splenius cavitis. Splenius cavitis. Splenius cervicis. Cavitis cervicis. Levator scapulae, anterior, middle, posterior scalene. Oh, they have the scalene. Okay, let me tell you something about the scalenes. Okay, scalenes. I don't want you to mix them up. Okay, when you look at the scalenes, you should see them here in this view, but I will highlight them for you. Very important for the scalene. You have interior, middle, and posterior. Anterior scalene, medial scalenus, and then posterior scalenus. Get oriented in this way. Look at the ribs. Rib 1 is going to be either anterior or middle. I'm going to tell you how to differentiate them, anterior and middle. Rib 2 is going to be definitely posterior. Okay? Anterior scalene, it comes to the rib number 1 from the front. This here. This is scalene anterior, scalenus anterior, right there. And you see, look at this. It comes to the anterior border of rib number 1. The middle scalene, they come from the superior border of rib number 1. This is middle scalene, scalenus middle. And then posterior, they go to rib number 2. You don't see it very clear, but it's right there. This is going to be, they go all the way. I can remove this. I can remove the serratus to show you. Just to show you that they are going, see, they are going to rib number 2. This is rib number 2. So the posterior scalene, they go to rib number 2. One more time. 3 scalenus muscles, right? I'm saying it in Latin, but you can write it scalene. Scalenus, yeah, this is basically the Latin name. The way I learned it in Latin. So scalenus, you have 3. So anterior, middle, and posterior. Anterior, middle, posterior. Anterior, middle, posterior. Um, Usually, it's the upper part will be tough to identify, but the lower part is easy because you have a relationship to the ribs. Anterior scalene is the one that usually, and there is nothing in front of it, as you can see right there. This area has just connective tissue. This area, because this is the axis of the blood vessels and all that. So anterior to it, you don't see any muscle basically. So, but that's it. So rib number 1 from the anterior aspect, anterior scalene. From the superior aspect of the rib number 1, that's the middle scalene. If you see, it is not rib number 1. It's going deep in there. So it has to be this muscle, right? Posterior scalene. So this is
Okay.
the serratus connecting there because they all part of the accessory muscles for labored breathing. So people who suffer, for example, like COPD and all that, when they use, like, these are the accessory muscles to elevate the ribs to increase the size of the thoracic cage. Okay. Any question on the scalenus?
No.
All right.
Good.
So now let's come to this area under the chin. Under the chin. So we already talked about this one. This is the digastric. I'm going to remove it. So under the chin, you're going to have one like right there, the flatter one. The flatter one wishes to make a rafi with the other one on the other side. They kind of like connect here. They make the floor of the mouse. And look at the shape. I'm going to remove it from one side to show you the shape for the one that underneath, which is going to be the genohyoid, which is completely different in the shape. Mylohyoid, it looks like this triangle. It basically it covered the entire triangle under the mandible. I'm going to remove it. See the difference? The genohyoid is not like that. Look at this triangle. Let's remove this so you can see, so you can compare them. Triangular one, that's mylohyoid. Just like a strap like this, they are both connected to the hyoid bone. These are part of the suprahyoid muscle by classification. Suprahyoid, above the hyoid bone. So mylohyoid, and then this is the mylohyoid, and this is the geniohyoid. Mylohyoid, geniohyoid. Mylohyoid, geniohyoid. To make stuff even more complex, there is one underneath. It's the glossohyoid. This one right there. This one. Genoglossus, sorry, genoglossus, genoglossus. So genohyoid, because genio from the genio tubercle right there in the mandible, and the one that goes from the genius tubercle to the tongue is going to be genioglossus. The one that goes to the hyoid bone is the geniohyoid. But genoglossus is not in the list. I'm just giving it to you like, yeah. So my law, remember my law, you use the Y as a triangle to remind you the Milo, the one that with the Y is the Milo the triangular one. And then the one underneath it is going to be the geniohyoid. Yeah. The one that is not attached to the hyoid bone, but attached to the tongue is the genioglossus. But genioglossus is
Okay.
not in the list. Got it? And then omohyoid, uh, omohyoid, I already showed you omohyoid. Okay. All right. So we already did the nerves. Oh, in the nerves, I didn't show you again. I didn't show you
Did you tell us
vagus.
that oma means shoulder? The
Yeah,
omohyoid. The
yeah.
word oma.
Yeah, omo means pertaining to a shoulder. Yeah. Uh, yeah, it has to be in Latin. What is omo in omohyoid? Let's look at it. Shoulder. Yeah,
Okay.
refer to the shoulder. In Greek. These Greek guys screwed everybody up by making all these crazy names. All right,
Yeah.
now I wanted to get oriented on. So let's remove. Let's remove. See, when you look at these, I don't know. Is it easy to do it by the size of the nerve? Because I can spot Vegas anytime just by its size. So that's gonna be Vegas. So because it travels like me, if you have the blood, I don't know if he's gonna leave the blood vessels, or if you're gonna have the blood vessels. If you have the blood vessels intact, it actually makes it easy because it's lateral. It is lateral to the common carotid, right there. While 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 if you go all the way to the side, lateral, that will be the phrenic nerve. So the one that
Okay.
closer to the common carotid, if he's gonna leave, then the nerves, I
Yes.
mean the blood vessels intact. The one that is lateral is the phrenic. Now, the phrenic, another thing you can identify what with the phrenic, it because it comes like from the cervical plexus. So it comes from all these guys right there, 3, 4, and 5, as you can see right there. But that's tough to call to say if you're gonna see that part or not. But the one that's medial, just medial and thicker in the diameter, is gonna be Vegas.
Vegas.
Yeah. All right. Now, wanna do the veins, or what do you feel? Uh,
Yeah, that'll be good.
yeah, let's do the veins. Okay. I can do the veins. You wanna do it on a naked skull? So remember, I told you the thing. The easy way to remember it is the nerves of the skull drain to the face. Nerve. Veins of the skull drain to the face. Nerves of the face drain to the neck, and the neck eventually gonna drain into the back into the cardiovascular system because you are returning the blood back. So so here you go. Now we can do it this way or with everything like intact. Okay, so because we are making our way back to the cardiovascular system. So now orientation wise by the bones, right? So you're going to have frontal bone, of course, parietal bone, and occipital bone, and temporal bone. Okay, so you're going to have this uh, vein which basically in the temporal region, and that's why it's called superficial temporal vein, right? However, it gets tributaries from two, from the frontal part and the parietal part. Frontal part, parietal part. And that's why you're going to have this one here is going to be superficial temporal frontal branch, and this is going to be superficial temporal parietal branch. So the two are going to merge, and it's going to give you this guy, which is going to be superficial temporal, superficial temporal. It gets it gets more tributaries, right? It gets one, even if it's not on the list. Let's look at it, which is going to be your, again, anterior to the auricle, and I'm going to call it anterior auricular. Okay, anterior auricular. This one is my zygomatic bone, right? Do you agree? So the one that coming from the zygomatic bone is going to be zygomatic, right? Zygomatico orbital. Okay, because coming from the orbit and the zygomatic bone, right? So these are going to be minor attributary. This one right by, remember this guy, the this process, the zygomatic process right there. This is called the transverse. This one right there. It's called the transverse. Transverse facial. Transverse facial. So all these branches, what I just named, are going to give you this guy, which is going to be superficial temporal vein, superficial temporal vein, superficial temporal vein. Superficial temporal vein are going to get one more tributary from behind the auricle, and that's going to be your posterior auricular, posterior auricular. So remember this here is this one right there. Uh, the one ahead of the auricle is the interior auricular. The one behind is the posterior auricular. But nonetheless, all these here together with zygomatical orbital, the transverse, are going to merge and going to give you this guy. Now, this is going to be the important part. All of this merger is going to give you this one. This is highly tested. I've seen it like in so many boards. It's a retromandibular. This is right behind the mandible right there is going to be retromandibular, because retromandibular is going to be the primary vein that eventually going to make two systems. Either you are going towards the facial vein system, or you are going towards the jugular system. Okay, so you have this one system is called facial system. This one here is called the jugular system. We'll talk about the jugular system in a minute. So basically what's going to happen, the retromandibular is going to have two branches. It's going to have two trunks. One is going to be the anterior trunk. Come on, this is going to be your anterior trunk. This one is going to be posterior trunk. Anterior trunk, posterior trunk. When you get to retromandibular, that's it. You're done. Anterior trunk, posterior trunk. Anterior trunk, posterior trunk. Anterior trunk, posterior trunk. Now, posterior trunk. let's do posterior trunk first. Is going to get very important branch, which is the occipital. See this one here? I didn't touch this yet. See, this is the main occipital one. This just one, it'll highlight all, draining all the occipit basically. Okay? So with the posterior trunk, merger with the occipital is what's going to give you the external jugular. That's it, done. And then you take the external jugular. As you can see, external jugular has no more in the cervical region. It doesn't get any more tributaries all the way down until way down here, where it's going to just merge with the anterior system. This here is the anterior jugular system. This here is called the anterior jugular system. I'm so sorry. I'm teaching it to you the way that um, it's not just naming, but to learn the system themselves. We have external jugular system, you have internal jugular system, and then have anterior jugular system. So, because if you study it this way, then you'll remember it. Okay. Anyways, so one more time, back to our story. Retromandibular. Retromandibular, two divisions: anterior division, posterior division. Posterior division gets the major attributary, which is going to be the occipital vein. Okay. Because later on, when
Okay.
we study the brain, when we dig inside the brain, we'll talk about the sinus system. Sinus systems are going to drain into completely different system, which is the internal jugular system. Anyways, so posterior is going to merge, you're going to get a tributary from the occipital, and that's what's going to give you the external jugular system. Done. That's it. All right. Now let's look at the anterior jugulars, anterior trunk. The anterior trunk is the one that eventually going to give us. This is the anterior uh, retromandibular anterior division. Anterior division, what is going to happen is going to continue and is going to become known as the facial nerve, facial vein,
Okay.
facial vein. Yeah, facial vein. Right? So now this is going to be your common. The common is going to give you here. So the common, which is going to be basically the merger with the internal jugular, is this one is known as the common facial vein, common facial vein. Common facial vein is going to get a tributary underneath. This is the lingual right there. This is the lingual. So the lingual is going to feed into the common facial vein, and the common facial vein is going to continue down and is going to become this. This is the superior thyroid. I don't think the superior thyroid in the list. The superior thyroid. So superior thyroid and lingual are going to drain into the common facial. Common facial drains into the internal jugular. Okay. Now all the facial nerves of, I keep saying nerves, all the facial veins, for example, like this one, which is the angular, then you have the the facial nerve proper, the superior labial, the inferior labial, all these basically they are draining into the facial. So all of them are draining into the facial. The submandibular, this one right there, segmental, right? All of them drain into the facial. Veins. So they have it for you: subclavian, internal jugular, external jugular, anterior jugular, retromandibular. Definitely retromandibular is going to be, and then facial. Okay, so they have the major ones. So the major ones is easy to cover. So basically, you're going to continue. Internal jugular and external jugular are going to drain into the subclavian. Shall I have it highlighted? Subclavian, they have subclavian in the list. Subclavian is going to, after it merges with the internal jugular, is going to give you this guy, which is going to be your brachiocephalic from each side. You have brachiocephalic. These are the one going to give you superior
Peace.
vena cava. So internal jugular, anterior jugular. Yeah, anterior jugular, they have it in the list. So don't confuse those. Anterior jugular, you just go anterior right there. This is the anterior jugular from each side. Anterior jugular, anterior jugular. So this one is anterior jugular. This is the internal jugular, and this is the external jugular. Anterior jugular, they make a bridge between them. You see, anterior jugular from the right, anterior jugular from the left, they actually bridge. They make the arch, the jugular venous arch. So we did the subclavian, internal jugular, external jugular, uh, anterior jugular, retromandibular, and then facial. Now, arteries. Guys, tell me, don't let me just like run my mouse.
We hear you. We're listening.
Okay, because I can talk. I'm gonna leave the veins to make it like complex, okay? So
Okay.
one thing you want to remember, there is a difference between the right side and the left side when it comes to the arteries. On the right side, you can see right there, this is going to be my brachiocephalic. I have a brachiocephalic trunk. Brachiocephalic trunk. There is no brachiocephalic trunk on the left. So from the aortic arch, you have a brachiocephalic on the right, and then you have the left common carotid, and then you have the left subclavian right there. From the aortic arch, I'm selecting the aortic arch. On the right side, brachiocephalic. Left side, you're going to have left common carotid and left subclavian. You can go all the way down there, so left subclavian. On the right side, the brachiocephalic is going to divide to two. It's going to divide to the subclavian, as you can see, subclavian, and the right common carotid. So the right common carotid is a branch from the brachiocephalic. Is a branch from the brachiocephalic. And then you continue, brachiocephalic. There is at this point, after you have this bifurcation, after you have common carotid and right subclavian, there is no difference. The story is the same, right and left. Subclavian is going to become axillary, axillary is going to become brachial, and so on. So the common carotid is going to divide to internal and external. So there is no difference at this point between the right and the left. Okay. So subclavian you have seen common carotid, then you have internal carotid. Now it's a little bit busy here, but it's fine. You'll figure it out. I can remove the veins, but I told you the trick. The trick in the anatomy or anywhere you have software, when you look at the arteries, which one is internal, which one is external, like this. If they give you an image like this, and just very quickly you want to identify, immediately look at the one. For example, I'm looking at this one and this one. This one has a branch, I'm going to ignore it. That's external. This is an internal. Make sense? Because the internal doesn't give any branches in the neck region. It just goes straight.
So if it has a branch, we automatically know that it's external. If it has a branch.
Absolutely, 100%. 100%, yeah. Because see, the internal doesn't give you any branches. It marches all the way until it gets into the internal acoustic meatus right there. Yeah, internal, the carotid canal, sorry, the carotid canal all the way in, and it supplies the 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 brain basically. You have two brain arteries. One is this guy, vertebral artery, and the carotid right there. Okay. So now if it
And
gives you
before it branches, it's the common carotid, right?
before it branches, yeah, right, very good. Before it branches is the common here until it branches. The bifurcation usually at the border of the it should be lower, slightly lower, but visible body has it like somewhere. Usually it branches right at the lower border of the thyroid cartilage, but that's fine.
Okay.
Now let's look at the branches of the external carotid. This is my external carotid. External carotid gives you lots of branches. If you want to go in order, which is easy to do when you go in order, the first one is going to be this guy, which is the laryngeal. It's the ascending pharyngeal branch. It goes to the pharynx all the way up. Okay. So this is the first branch all the way from the external right there. Goes all the way up. The lowest part right there. Come on. Yeah. Then it gives you one, goes to the thyroid. Remember, in this area, that's where you have the thyroid gland. So this is going to be your superior thyroid. Superior thyroid. Thyroid gets lots of branches. So one of them comes right from here, That's going to be your inferior thyroid. You're going to be your thyroid ema. So you have one, the thyroid ema, and then you have inferior thyroid right there. So it has three branches. So the one in the middle, that's the thyroid, the ema artery, and then the inferior thyroid. The inferior thyroid is a branch of the trunk of this guy, of the thyrocervical trunk. Okay, that's the inferior thyroid. The superior thyroid is a branch from the external carotid. Superior thyroid. So you have superior thyroid, and then you continue. You get this branch right there, which is going to the tongue. That's going to be your lingual branch. See, inferior thyroid, lingual. Now, lingual is easy to spot because it tucks underneath the mandible right there. Then you continue. Now you get to the major branches of the external thyroid. One that runs right by the border. Remember, I told you you can feel the pulse there. This one right there is going to be is the your facial nerve, or facial artery. Okay, facial artery. Right at the same direction, posterior, you're going to have the auricular one, the occipital, going towards the occipital one. The occipital one goes all the way to the back to the occipit, right? And then the auricular one, posterior auricular one. Okay. So the first one, right in the border with the facial, is going to be occipital, facial, occipital, facial. Anterior is the facial, posterior is the occipital. Then you continue, you get the posterior auricular. Tucked very deep in there is the maxillary, which is this one right there. Very deep. It's going to be the maxillary. And then it's going to be, after the maxillary, this is basically the terminal branch. So the terminal branch is going to be superficial temporal. Remember, we had also the vein, same thing, superficial temporal. If we add the veins, you're going to see the same. So superficial temporal, superficial temporal. Posterior auricular, posterior auricular. Okay. Occipital, occipital, and so on. So facial, facial, yeah. But uh, so lingual, facial. Oh, we still have other ones to show you. Are we okay on this, or do you want me to go over it one more time?
We're good.
Yeah, I
Okay,
think I'm
okay.
good there.
Okay, now let's do this because we have lingual, facial, and then we have thyrocervical trunk. So when you come to the subclavian, you're gonna have thyrocervical trunk. They have it in the list. So thyrocervical trunk is the one that gives you these branches. It gives you the one that we just talked about, the inferior thyroid. It gives you this branch, which is going to be the transverse cervical artery. Terminal branch for it is the superficial cervical artery, transverse cervical. Remember the nerve, the transverse nerve is similar to this, it's the same location. And then the suprascapular. You have suprascapular in the list. You have transverse cervical, suprascapular, inferior thyroid. Okay. And then dorsal.
Suprascapular comes from the thyrocervical trunk.
Yeah, the three. Yeah.
Okay.
So the three branches are going to be the way they have it in the list, just like they're just throwing them in the list without any relationship. It should say thyrocervical trunk, and then underneath the thyrocervical, for example, you have and then 1, 2, 3, because these are branches of the thyrocervical trunk. So see, they have it. Uh, if you go thyrocervical trunk, and then they have suprascapular, transverse, inferior thyroid. They are just listing them, but these are branch. Inferior thyroid is the branch. This one, the transverse cervical, is a branch of the trunk, as you can see right there. And the terminal branch is going to be just the superficial cervical artery transverse cervical. And then the suprascapular, these are all three branches from the thyrocervical trunk, because that's why it's called trunk. Then later on, from the subclavian, as you continue on the subclavian, before you get to the, before it becomes axillary, by the way, subclavian, it gives you two major branches. One of them is this guy right there, which is going to be your dorsal scapular. Now, dorsal scapular, look at it. It's the one that goes all the way. It supplies supraspinatus and infraspinatus. So, so, and this one here is suprascapular branch. Also, another branch supplies also these two muscles. Man, they are writing too much. But it doesn't tell you. But yeah, it supplies, because that's all you have here. Now, this one goes deep though. It goes right by the border, as you can see, right by the border, the medial border of the scapula, right? So, so these are the one that you have: transverse, inferior thyroid, dorsal scapular. Right? That's the last one, is dorsal scapular. Costocervical trunk is going to be this guy. What is the costocervical? I didn't show you the costocervical last time, did I? Uh, let's look for it. I don't know if I have it here. On the left. Yeah. Where is it on the right then? Yeah, right there. Very tiny. See? It's just a tiny stump right there. The costocervical. So you have two back to back. So this one here is the thyrocervical trunk, and this next to it is the costocervical. Costocervical give you the deep cervical artery. It's only two branches, and this one right there, which is the supreme intercostal, is the highest artery, the one that goes, because this is the one that supplies rib number one. I mean, not the rib itself, the the muscles, the intercostal muscles between rib number one and rib number two. Then after that, you're gonna go just, they're going to be the intercostal ones. 1, 2, 3. Visible body gives you from 3 to 10, but 1 and 2 is going to be this one right there. Second intercostal and the supreme. See, which are branches from this guy. From the supreme intercostal, you get 1 and 2. And then from that point on, it's just going to go 3 all the way to 10. These are going to be your intercostal arteries all the way. And then 11, this is 11. 11 gets, it is on 1, 11, and then 12 is going to be done at the subcostal. This one here is going to be known as the subcostal. They don't call it 12. I don't know why they call it the subcostal. 11 and 12, they are special because these are special ribs, so they have their own. But 3 to 10 is just one selection. 1 and 2, they are special because they come from this trunk. You have to dig for it. I keep missing it right there. Because very tiny. So in your in the anatomage, I don't know if he was so. Have you seen it in the anatomage, the costocervical?
Um,
I'm
we
looking.
got to search through our pictures.
Oh, okay, no worries. So these all the arteries and the nerves and the veins. Uh, let's do this. How you feel about the muscle? Because more than likely, guys, although we are thinking about it like very deep, don't forget, because they will have some of these easy to pin muscles. So they are not gonna go dig into. I don't think so, unless they have it preset. But I don't want you to miss on the big, because we are concentrating on tiny stuff, but don't miss the big stuff either, right? So let's
Right.
review the back muscles. What do you want to say, Laundry?
That's what I was gonna say. Is the back muscles. That's fine.
Yeah, because I mean, I don't know about other instructors. Personally, for me, sometimes if I have exam to set up, uh, it the biggest stuff is like easy to pin. And I think everybody does that, but some people just go dig for very tiny stuff somewhere. Anyways, so this one here is trapezius. So trapezius, of course, from each side. Isotrapezius muscles. So I'm going to start removing from one side, and then I'm going to leave the second side for review. Okay. So that's the trapezius. I took it out. So after trapezius, so trapezius is going to be the superficial muscles first. Let's do superficial muscle. So trapezius is one of them. I just removed it. So after trapezius, as soon as you remove trapezius, then you're going to see two rhomboides, right? Rhomboides minor and rhomboides major. Rhomboides minor, rhomboides major. Rhomboides minor, major, and levator scapula, which we already talked about. So it's going to be your superficial muscles. Okay. Trapezius, one of them. I remove trapezius on this side. As soon as you remove trapezius, then you will see rhomboides minor and rhomboides major. Rhomboides minor, major, and levator scapulae. Okay. So, and of course, one of the big superficial ones is the latissimus dorsi. Latissimus dorsi, I'm gonna hide it. So now we're gonna go to the intermediate layer. So I'm gonna remove rhomboides minor, remove rhomboides major. I'm going to remove levator scapulae. Then you're gonna see the intermediate. Intermediate muscle is gonna be just two. It's gonna be serratus posterior superior and serratus posterior inferior. Serratus posterior superior, serratus posterior inferior. Okay. Now, when you remove these two serratus muscles, you want to go to, let's remove sternocleidomastoid. So you will see the splenius. You have two splenius. Splenius cavities. Just go to oriented. The one that goes all the way to the skull, right there. This is cavities. And I'm going to show you now in a second. So that's cavities, splenius cavities, very high up. If you remove it, then you're going to see another splenius, which doesn't go all the way up in the cervical region only. So going to be a splenius cervicis. Doesn't go to the occiput. There's going to be a splenius cervicus or cervicis, right? So it's going to be our two like bandage muscles. Splenius is splenius. I'm going to hide it, right? So now what we do we have to see of the one muscle has several components to it, okay? Rectal spine muscle. My advice is to go from lateral to medial. So rectal spine muscle is all this muscle right there. Okay. So basically, if you go all the way lateral, then you will see this muscle has several parts to it. The part that comes from the ilium all the way down here is the iliocostalis lumborum. It's all iliocostalis. Any part of it you select is going to tell you iliocostalis. Iliocostalis. So the name of the muscle is iliocostalis, but you have different regions. Iliocostalis lumborum, iliocostalis lumborum. Then you have iliocostalis, very tiny here in this region. This is the iliocostalis thoracis, iliocostalis thoracis. And then the last one is going to be your iliocostalis cervicis or cervicus. So it's going to be your iliocostalis. Even without removing it, this second part is going to be longissimus. Now, longissimus, it doesn't have a lumborum part. It just goes from thoracis, but it goes all the way to cavities. And that's why it's called longissimus. It's the longest of the three. So the longissimus, longissimus thoracis, longissimus cervicis, and then you have longissimus cavities. Okay. So if you selected all of it, if I do multi-selection, you will see it's a very long one. That's longissimus. Okay. So now I'm gonna have to remove longissimus. I'm gonna have to remove this guy as well. Now, if you go all the way in, then you're gonna see the spinalis. So spinalis has to be in. So that's going to be your spinalis. Now, spinalis has several parts. So the one that highlighted here is the spinalis thoracis. Spinalis thoracis. Now, I will show you the rest of the spinalis, but before we go there, we have to look at this one, which is the semispinalis, which is the one that you are seeing here is the semispinalis. I'm going to leave spinalis intact, but the semispinalis, now for your purpose in the anatomage, you have just the spinalis, but in spinalis cavities, right? This all are spinalis cavities, these two parts. But visible body is being just very anal about it. So it's having it divided to spinalis cavities lateral fascicles and spinalis cavities medial fascicles. But if I do multi-selection, all this here in the anatomage is going to be the spinalis, semispinalis cavities, semispinalis cavities, okay? But just here is just being like very specific about it. Semispinalis cavities lateral, semispinalis cavities medial branches. Okay, so I'm going to remove it. So that's one of the semispinalis. The second one is going to be the semispinalis cervicis, because the cavities one come from the occiput. The cervicis one or cervix one is from the cervical vertebrae right there. See, like the C1, this is a C2, a C1, C2, a C3, and so on. So, yeah, all right. So that's the sema spinalis. The last one is going to be this one. So let's remove this because I want to show you the other one. This is the sema spinalis right there. Psoriasis. Sema spinalis psoriasis. I'm going to hide it. So now you can see the spinalis very well. It's all the spinalis, which is the deep in the, now aside from the spinalis, I'm gonna remove the spinalis. I want to show you multifidus. Now remember I told you this trick. Now for multifidus, not to confuse it with anything else, it's the one that comes all the way down here. If they have multifidus selected, you will not miss it. I'm sure you will not miss it because you look at the multifidus in the lumbar region, you're gonna see like how massive it is in the lumbar region. That's multifidus all the way. I'm gonna hide it. Now we're gonna look at the rotatories. So you're gonna basically when it comes to the rotatories, they go like diagonal like this. You look at the because the way that they are started from the one from the process transverse process goes all the way, but you have two of them. You have you don't have them as longi, they have just as rotatories. So if they selected this rotatories for you or this rotatories, you're still gonna have to say rotatories. But in reality, there is two of them. The one that skips one, see, skip from here, then skip this one and goes to the upper one. That's the longest one, and that's why the longi part. Brevis is the one that's short. So this is a rotatoris longi, and this is a rotatoris brevis. Then you have this one in the list. This is the levator costarum. Again, these are connected to the ribs. Levator costarum connected to the ribs. So, and that's why costarum, the part of it. You have a longi and brevis. Okay, longi and brevis. And then this one here is the intertransversary. Intertransversary between the transverse processes. It's called intertransversary. But there's several of them. But this is the intertransversary. Good? How do you feel about the muscles?
Yeah, I was really confused on the rotatorus versus the multifidus, so that helped me a lot.
Oh, yeah. Oh, absolutely. So the multifidus one, which I removed, the multifidus one, always look at the lumbar region. It's huge in the lumbar region. Now for rotatoris, all you have to do is it's not, it doesn't, it's not a massive muscle, and it just goes diagonal, because it starts from the transverse process of each thoracic vertebrae, and inserts in the spinous process, either on the one above it or it skips one. So for the longi, it's going to skip one. For the brevis, it's just going to insert on the next one. All right. Any questions? These are all intertransversary. It depends on the region. This is the lumborum part. Intertransversary between the transverse processes. Transverse process of the vertebrae, adjacent vertebra above it. So, and that's why they call them intertransversary. All right. Anything else? Any questions? Anything you want me to show you? You guys are quiet.
I'm looking over the list.
Oh, okay. Oh, by the way, let me see. I used to have so much PowerPoint slides, but at this point, I'm gonna dig on my PowerPoint slides to see. Uh, back muscles. Oh, one thing I need to show you. I forgot. Now I remember. Yeah, these muscles. How do you feel about these muscles? We didn't review these on the occipital triangle. So occipital triangle, when you look at this occipital triangle, you're gonna have several muscles here. So now rectus, the straight one. So we have rectus capitis posterior. This is the minor one. And then you're gonna have the rectus capitis posterior major. So these are the straight. And then you have obligus, right? So it's gonna be rectus, rectus, two recti. So rectus posterior minor, and then rectus posterior major. And then you have these two, which is the obligus, or obligus. These are the oblique one. Capitis superior and inferior. So for the obligus or the obligus is going to be superior, inferior, and for the rectus, minor and major. And then if they show you the artery, which I'm just going to add arteries there. So your artery is the vertebral artery, which comes across. This is C1. So it comes across C1 and it just enter into the foramen magnum. You see right there, foramen magnum. That's where it enters, right? So this is a C1 and this is the vertebral artery. And the nerve is going to be this guy right there, which is the C1. So the C1, the nerve. So C1, which is the spinal nerve, the ventral ramus, and the vertebral artery. They are both, you find them in this triangle, in the occipital triangle. I just remember from my slides. Yeah, I have some slides here, but it's not that much.
So I was looking at the list that says the deep structures of the neck, um, and I was wondering, could you show? Maybe I missed it if you already showed it, but it's the I don't know how to say it. Isthmus, Isthmus.
The isthmus. Oh, they're talking about the thyroid gland for the isthmus. Yeah, let's do it. I don't know if I have it here with the isthmus. So basically, for the thyroid gland, it has two parts. Isthmus is the part where it connect the two part of the thyroid. I didn't show you the thyroid gland. Yeah. Um, let's bring this guy. So I have to remove the sternum. I think I have it here. The gland is right there, retrosternum, but I don't have it. Let's add it. Uh, Thyroid gland. Oh, actually, said it's there. Yeah. Uh, are they talking about the thyroid gland or talking about the thymus? Because I was thinking I was talking about the thyroid, but trying to look for the thymus. So, but the thyroid gland, I don't have the isthmus for it. You're just showing the gland itself. I don't know if they have it in the thyroid gland images. When you look at the gland itself, here you go. This one has the isthmus. But it's not, see, it has two lobes. So you have a left lobe and a right lobe, and in the middle where they connect, that's called the isthmus. And behind the thyroid gland, usually you can't see it in the anatomage or any of this. That's a parathyroid. Usually you don't see it. But the isthmus is part of the thyroid gland.
Okay, so it's just where they meet the lobes.
Right. Yeah, where the two they meet. Yeah. That's
Okay.
called the isthmus.
Thank you.
Of course, yeah, yeah, yeah. Now, visible body is not. It's not going to show you the. It's good that they're showing the entire gland, but it's much. But this image is good because remember the blood supply we talked about. This is going to be the ema, and then you have the superior right there. The superior, and then the inferior right there. These are the three blood supply to the thyroid gland. uh this application it improved so much. It wasn't like this large before. Oh, see, this is the jugular system that I was talking about. They just have the system, both of them, the showing you the external, the internal, and the anterior in relationship to other organs. So they have a model for it by itself in relation. Remove all the muscles and having it like in one area instead of like adding the the arteries and the veins as you go. What time is your exam tomorrow?
I think it's at 10 o'clock.
Wow. Yeah.
He did find the parathyroid glands on the table the other day, so probably gonna pin that.
Parathyroid?
Yes.
Oh, he did? Oh.
He found them.
Basically, parathyroid, you're gonna have to go just behind the thyroid.
I tried to ask him, like, whenever he picks a structure, I was picking things off the list and saying, like, what would you take off around this so that we could see it, so that we could study from it looking like that, like have those same reference points. But he wouldn't tell us. And he said that he won't use any presets. He's just gonna go in and pick random things.
What is it? What is the? I don't even look at it. What is the division for the grade? Are they equal?
I think with your class and his class,
Yeah.
Yeah.
50-50.
Yeah, I think they're 50-50.
Oh, okay.
And then one, I think, if it's the same as the other gross class, we get a bonus for each, like one
Yeah,
bonus.
I don't know if he decided that. I mean, I don't know which one of y'all gonna give us the extra credit, but somebody is. Yeah, the bonus one, the bonus question.
Oh, it's only one bonus?
That's what.
Oh,
That's
For
what he
each
said.
exam, yeah.
Well, I'm gonna tell him I'm giving the bonus question.
All right. Take
I
that.
see him. Just do your best. I mean, at this point, I mean, whatever images you have, whatever pictures you have, go over them, and I think you'll do fine. I think he was mostly stressing the people rather than anything else.
Yes, he's very stressful. There's somebody in there who's taken a class with him before, and they said that his exams are unlike any other professor's exams.
Really, I don't know what the purpose of all this. Yeah.
I'm not sure, but thank you very, very much for spending so much
Oh,
time.
of course. Yeah. Anytime, please. Yeah. And hopefully I'll be maybe sometime next week or something to go over some of the stuff on the anatomash for after this over with. So it's just this quarter my availability on Canvas is not that much. So like Monday, I don't have anything on Mondays. So
Well, this is great. This is very helpful.
oh,
This
this definitely, because if you have the image, if you've seen it, although it's different from the anatomage, of course, yeah, it's not the same, but at least it will give you the perspective of where it could be or where you find it or how it looks like or the relationship between this structure to another one and so on. Yeah, definitely.
It's much better to learn it when you learn relationships, because then you can orient yourself. So thank you for teaching it like that. We appreciate
Oh,
it.
of course, yeah. All right, well, good luck tomorrow and let me know. I'll see you Thursday, right?
Yeah, Thursday.
Yes.
Yeah.
Okay, well, thank you
All
very
right,
much.
good luck.
Good
Good
night.
luck. All right. Thank you. All right.
Have
Thank
a
you.
wonderful night.
You too. Thank you. Bye bye.